Namaste everyone. So today we'll be dealing with an interesting topic, that is mastopathy in Ayurveda. Mastopathy. Now, this is a very broad term. This term was being used for any of the breast disorders earlier, like it could be specific or vague, but these days mastopathy is becoming more focused on to refer to a benign hormone-dependent glandular change in the tissue of the breast. So it is hormone dependent and a physical change in the glandular tissue of the breast. And so this change could be temporary change, or it could lead on to something more stable and permanent. So the change in the glandular tissue of the breast would usually happen either in the form of a nodule, or it is more firm like a cyst, or there would be swellings. So any type of such a change. So it could be nodule, which is either just the like hardening of the glandular tissue, or it could convert itself into something like fibrocystic presentation as well. So coming to mastopathy, this is usually hormone related, as I said earlier, and the presentation is more predominant just before the menstrual cycle begins. So a week or 10 days before the menstrual cycle begins, then there would be these presentations, which would be like the appearance of this nodule, or the hard or firmer mass in the breast, which could be on both the sides most of the time, or on one of the sides. And usually it might even go off after the menstruation of that month is over. So these, again, because say all of these are interrelated and hormone dependent, at times it might mimic like what we usually put in the premenstrual symptoms. So the PMS would also have some kind of breast presentations, and these would just mimic the same. It is different only when there is a proper nodule or a cystic swelling, and this has a tendency either to just resolve after the periods, or sometimes it might lead to a permanent change, leading to a proper fibrocystic development in the breast. And this is more common in the age group between 30 to 50, whereas PMS can occur even in the adolescence and so on. So mastopathies are common in the older age group, like over 30, 40, in 40s or 50s, if at all the periods is still going on. The more important variety of mastopathy would be within the one that is related to diabetic condition. In diabetic or pre-diabetic condition, the kind of mastopathy that develops is usually of more focus. So these mastopathies are usually called as lymphocystic mastopathy or diabetic mastopathy. And as the name suggests, there is a lot of infiltration of lymphocystic tissue here, like the cystic development, which is related to the lymphatic drainage as well. And that becomes more of a concern. Overall, any change in the anatomical structure in the glandular areas of the breast, or even in the skin. So any of the anatomical changes which stay for a longer period can carry a risk of breast cancer. And diabetic mastopathy is also one of those conditions which usually could be self-limiting, but if it persists for a very long time, then it can be considered as precancerous as well. So, as we discussed, they are usually hormone dependent. And the main hormones that come into play are estrogen and progesterone. So it is estimated that when the estrogen concentration is more and there is deficiency of progesterone in the body, that is when such mastopathies occur. And the symptoms, as I said, would be usually associated with more fullness of the breast, and it could be actual physical swelling as well. And sometimes there is excessive tightness of the breast and associated with pain. And in people who have thyroid dysfunction or are already pre-diabetic or diabetic, have other hormone-related disorders, the tendency or the frequency of developing this kind of mastopathy is slightly increased. And I'll come to that next sentence.
Хорошо. Если мы конкретно еще рассматриваем вариант диабетической мастопатии, то вероятность нарушения гормонального фона еще более повышается, так как в этом состоянии задействованы еще и другие гормоны.
There are a few other factors as well that could contribute to increasing the predisposition. And like any other general breast disorders, it would follow the same line, like having an early menarche or late menopause, because obviously this is related to hormones which run in the menstrual cycle, and having abortions, especially multiple abortions, or not having pregnancy, or not like stopping the breastfeeding forcefully. These are also some of the contributing factors. Other than these, there could be metabolic syndromes. Any of the metabolic syndromes like obesity or, as we said, diabetes can also contribute. Liver disorders can contribute to mastopathy, or stressful circumstances, wherein again there would be changes in the hormone levels, can also lead to mastopathies. There are different grades of its severity as well, and depending upon the grade of severity, the mastopathy, the prognosis can be somewhat evaluated. So in grade 1, which is the most common variety, about 70 to 80% of the mastopathies fall in this category, is a very simple mastopathy. There is just a little alteration in the connective tissue, and the milk ducts usually would be dilated. There could be cyst or there could be no cyst. That is not a diagnosing criteria. But the minimal alteration is usually seen, and this is the most commonest presentation of all the mastopathies. In grade 2, which is also called as proliferating mastopathy, so there is a little bit of growth in the milk ducts, and again the risk of developing or changing this into breast malignancy is also low, but it is probably slightly more than the grade 1, whereas grade 1 is exceptionally low. It is almost equal to nil. Whereas in grade 2, it is just a little bit of possibility that it might change because it is increasing, and that is a basic differentiating factor. And grade 3, which is the rarest form, that would have some kind of atypical cells developing within the milk duct system. So within the ducts, there will be some of the growths which are not really similar to the rest of it, and the changes could be more painful here. And this is the one which carries a slightly increased risk of turning into breast cancer. But the other two are really mostly harmless. And this is also nothing like it is cancerous. Over time, it might turn into that, so that is a kind of a risk. In all of the three conditions, there could be some secretions, like milk-like secretions coming out at any stage. Now, secretions are not diagnostic, so it is nothing like if a woman develops mastopathy and has secretions and it is painful, it is going to be very risky. Nothing like that. But when we say that there is atypical cells within the milk duct, it is more related to the type of the growth and not about the secretion. Yeah, that is about what we know about mastopathy in general. The diagnosis is usually done through ultrasonography, and the confirmation is done through biopsy. And still, as a treatment for mastopathy, usually nothing much is considered because it is self-limiting. So it is just wait and watch, and watch your lifestyle, watch your diet. So when we say it is related to diet and lifestyle, then it becomes more serious. When it is said that it is related to diet and lifestyle, people tend to take it very easily. But no, these are the things which are more serious, because that is something that we can prevent as well. So the things that we can prevent are of more importance, because as long as you can prevent, you don't have to suffer through all of that, and it is much in your own hands. So let us look at it from Ayurvedic perspective. So I hope you all know about the basics of Ayurveda. And here, let me bring your focus to what happens with Rasadhatu. So Rasadhatu is the first of the dhatus, and it is the first of the dhatu, or the tissue, if you can say it loosely so. So when the food gets transformed in the body, the first of the things that gets developed or processed is Rasadhatu. And rasa, along with many other functions, it also produces, or it also contributes to two main areas. And both these areas are related to a woman's system. One is the menstrual system, that is Artava, and the other one is Stanya, that is, it goes to the breast. And when it is time to produce the breast milk, it produces breast milk. In the rest of the times, it maintains the health of the breast. So, Rasadhatu is highly dependent, it is the concentrated nutrition from the food. It is highly dependent on the food as well, like whatever kind of food we take, it is the first product, and hence it carries the maximum components of the food. And this, without much of the filtering or without much of further processing, it goes to Artava and Stanya. That is for the menstrual organs and also to the breast. In the whole process, there is another important component that is working, and that is the Agni. So transformation of food to Rasadhatu also requires very good Agni, and the product is dependent upon the quality of Agni. And likewise, the transformation of Rasadhatu to either going to Artava or Stanya also requires certain Agni. And the quality would depend upon Agni here as well. And Rasadhatu mimics Kapha in much of its characteristics. So we can almost say that the physical form of Kapha mimics that of Rasadhatu, and it is one of the important carrier of Kapha. And this would obviously have, because it is so dynamic, it would obviously have the effect that is coming from the environment as well. Because say Kapha and Vata are just opposite to each other. They balance out each other. So when when there is increase of vata, kapha reduces, and when there is increase of kapha, it is vata that goes into depletion. So there is this kind of inverse proportion or inverse relationship between vata and kapha, which is directly in correlation with rasadhatu. So the percentage as well as quality of rasadhatu would most of the time influence the behavior of vata and kapha in the body. When we say environmental factors have an influence on vata and kapha, or for that matter rasadhatu, it is through our perception. So the kind of things that we indulge in, the kind of activities we do, the kind of, it could be the sound, it could be the touch, it could be the exposure to sun or wind, heat or cold, all of these things. It could be stress, or it could be the kind of pleasures we indulge in, these as well. So anything that can have an effect on mind can have an effect on the vata, because vata is so sensitive, and so anything that can have an effect on mind can have an effect on vata. And when vata increases, rasa decreases. This is a direct equation. And anything that causes decrease of vata, depletion of vata, also can have an effect on rasadhatu, that is increasing the rasadhatu quantitatively. Say, for example, excessive lethargy or laziness, sleeping during the daytime. All of these factors will reduce the activity in the body, reduce the metabolism, and thereby have an influence on the Agni overall. It could be in the like the physical Agni as well, like in the digestion and metabolic process, or it could be in the mind as well, as in decreased mental activity. So that is also a form of reduction of Agni. So all of these will naturally increase rasadhatu quantitatively as well as qualitatively, or in other words, we can say that it doesn't spend as much energy in the body. So whatever food we have consumed, whatever dhatus that have been formed, they stay as much without being utilized or consumed, and these are the ones that have got higher tendency to turn to ama. And coming to this conversion of rasadhatu to stanya and arthava as well, there is another agni here, and this is a very important agni because there is a lot of thought process. Stanya, or the breast milk, is produced on need basis only. So it is only for a very short period, and only in that time when there is a child who is probably of a certain age only to feed. There is no production of breast milk in the rest of her active or fertile lifetime. Whereas arthava, that is also very periodical. It follows a cycle of 26 to 28 days, and the agni, which is transforming rasadhatu to arthava, should also be very methodical as well to follow this cycle. If there is impairment of this agni, or if the raw material, that is the rasadhatu, is either corrupt qualitatively or quantitatively, then both could get affected, that is the stanya and the arthava. Stanya is only for limited period of time, so most of it is going to arthava. And arthava is, it includes the hormonal system, which is related to the reproductive system of a woman. It includes the anatomical as well as the physiological aspect of the whole of the reproductive system. It includes the hormonal effect of thyroid, of insulin, of growth hormone, of progesterone, estrogen, oxytocin, all of this. So rasadhatu mainly gets its content from both food as well as environment, and gets processed like the sources gets processed by the physical Agni as well as the Agni which is in the mind, because it influences Vata. So overall, the quality and quantity of Rasadhatu will have and Agni will have an influence on both Stanya and Artha. So if there is poor Agni, then the transformation is impaired. And cellular transformation also is related to Agni, and hence any kind of change in the body is always related to Agni. So when we say that there is glandular hyperplasia or hormone-dependent nodules that are produced, you can easily assume that there is some blockage or either there is poor Agni, and that is why the transformation is not proper. There are some physical deformities, or there is physical abnormality that is developing. Now, coming to the influencing factors, let us see that now that we know that food and environment will have an effect, let us see what kind of food and environment will have a specific effect on this part. Now, the tissue or the system of the breast has an influence from Vata, Pitta, Kapha, and it is made of Rakta, Mamsa and Medas. And along with that, as we discussed, it also has an influence from Rasadhatu. The whole of the organ of breast is made of or is influenced by Vata, Pitta and Kapha, Rakta, Mamsa and Medas. These are the dhatus, Rakta, Mamsa and Medas. And it also is highly influenced by Rasadhatu for functioning. So Rakta, Mamsa and Medas form the anatomical part of the breast, whereas Rasa regulates the function of the breast. And as you can see in this table on the slide, there are many factors that can cause a impairment or disturbance in these set. That is for Vata, the diet or the food that can have an adverse effect on Vata, you have it here. On Pitta, the lifestyle which can have an adverse effect on Vata is also present here. And then there are external or the time factor which can cause a vitiation of Vata is present here. Of that, I have highlighted in red the ones specifically which can contribute to the glandular development or the anatomical change, which can develop into either like precancerous or cancerous development as well. So these are the ones which are usually the most common factors you would find in many of these cases. The most commonest factor which can influence on all of these like the dhatus as well as the doshas, and which is against the person's prakriti, or which can vitiate the person's prakriti, can become the most strongest factor for the development of any kind of disorder. Now, I will request you all to look into this slide in detail later on, but as a proof of what we have discussed here, there are many researchers in today's world as well that is happening, which will mimic exactly the same thing that is all present in the earlier slide. So see, these are all the researchers that are done on mastopathies as well as breast cancer and the risk factor for breast cancer. So it could be the lifestyle, health history, environmental pollution, dietary pattern, and specifically consumption of sweet food. Increased indulgence in artificial sweeteners foods causes for obesity and all of those including so these have tendency to increase the density of any of the cell, and thereby they start proliferating or producing abnormality. And this is a very, very important factor, because even in all of the texts in Ayurveda, this is what we constantly say, that increasing indulgence in sweet substances, madhura, increases kapha, and thereby it increases the chances of producing arbuda or tumors. So, in short, we can sum up the pathological, or the most important causes as this. These are the properties which can very strongly vitiate vata, and that can lead to vata type of presentation, inflammations or swellings and glandular changes in the breast. Given here are the factors which will be triggering pitta, the usual pitta triggering factors, which can cause the pitta type of problems in breast. And Guru, Madhura, Shita, Snigdha, food and environment are the ones that can vitiate kapha, and that can produce these type of presentations, the kapha type of presentations in the breast. So how is a vata type of presentation in the breast? The vata presentation in the breast would be more painful, and the pain is the characteristic feature. Every cycle or perpetual pain, that would be more of a vata type of presentation. And if at all there is a swelling there, it would be more, it would be a light type of swelling, and irregular, probably. So irregular glandular swellings would be of vata. And here, when these are the presentations that are the same, then we need to focus on balancing vata. And pitta type of presentation wouldn't be usually associated with when we speak of mastopathies. The pitta type of presentations would be seen mostly in the inflammatory disorders of breast. However, just in case, like if at all there is an episode of burning sensation or increased vascularity causing inflammation or discomfort in the breast, that could be considered as the pitta presentation. The most common category where all of the mastopathies would fall is the kapha type of kapha vitiation. And here we would see the secretion, that is the milky secretion or the colorless secretion, or heaviness of the breast, actual swelling in the breast, or even the general tendency where there would be dull pulling pain or blockage. So that is the kapha type of presentation. Agni is characteristically low in all of these cases, and hence the influence of Pitta is also low. It is mostly the Vata and Kapha which are going in and out, and that is what is causing the whole of the problem. And that's why regulating the Agni and balancing out Vata and Kapha is the simplest solution, and it is the easiest solution either by diet or lifestyle. And here we have two pictures here. It is this picture is of general all of the breast presentations. It could be mastopathy, it could be growth, cyst, or tumors, anything, or even the inflammatory pathologies. All of the breast pathologies would come with the influence of these factors: Vata, Pitta, Kapha, Rakta, Mamsa, and Medas. And sometimes there is external cause as well. And the transformation of this to breast cancer, which is the most serious presentation that can occur in the breast. So you see that it is almost similar set: Vata, Pitta, Kapha, Rakta, Mamsa, and Medas. And then there is just another added combination of Vata and Rakta vitiation. So these tissues, dhatus, Rakta, Mamsa and Medas, physically, qualitatively and quantitatively, Rasa Dhatu as well, and the three doshas. These are the whole set of causative factors for any of the Stanaroga or breast disorders. And of these, sorry, is it too long?
Oh,
Is it
no,
okay?
it's fine.
Okay. So of these, for mastopathies in specific, it is Rasadhatu and Mamsa and Medas. We can exclude the influence of Rakta. It is mostly Mamsa and Medas that is causing the disturbance. So coming back to this slide of the Ahara Vihara, that is diet, lifestyle, and the external factors that can have an influence in the pathogenesis, we have to look into Mamsa, Medas, and Vata and Kapha. So anything that is extremely snigdha, guru, are all increasing or influencing Medas. The same can influence Mamsa as well, and the same can influence Kapha and inversely influence Vata. And anything that is snigdha, guru, as well as the ones which are of blocking type, abhishandi, as it is presented here. They are the ones which can also cause an impairment on Agni. And the causative factors among the lifestyle are also the similar ones. So anything that has got an influence on Agni or these, Mamsa, Medas, Kapha and Vata can produce similar effect on the Rasadhatu and also similar effect on the breast or all of these related organs. So, Rasadhatu is responsible for the functioning in the breast or also in the Artava, and it has got similar influence in both these places. So when this cycle is, or when Rasa is corrupt qualitatively or quantitatively, it can show up as menstrual disorders, it can show up as mastopathies, it can show up as hormonal disorders, which could lead to either diabetes or reduced thyroid functions and overall increase of lipid profile. So now coming to how do we manage this? The management, as we discussed earlier, these are the preventable situations, and that is why we have to look at it from the prevention perspective. It is so not after the mastopathy has developed, it starts before only. Whenever we indulge in all of these things and we see the preliminary features of the upset, or when we see the preliminary features of the imbalance of any of these. So there is a concept of Kriya Kala in Ayurveda. Kriya Kala are the stages when you have to take actions, when there is definitely some kind of imbalance in the body, and you have to, if you take steps to immediately correct it at this level, then it won't be developing into any of the serious diagnosable disorders in the future. So it diffuses in the first of the presentation of features of imbalance itself. So they are called Kriya Kala. And there are 6 Kriya Kalas, 6 stages of intervention, and 3 of them are specifically preventive, and the remaining 3 are more of a curative and management stages. In terms of dosha and not dhatu, because that is the first stage of imbalance. So the first of the stage where there is slight increase of dosha, that is called as chaya stage. And you recognize chaya with the features of dosha activity and as well as the quantity slightly increased. And say, for example, if the lethargy that you feel after a heavy meal, say you've gone to a grand dinner and after that you feel a little heavy, you wake up a little feeling a little heavier the next morning. That is the stage of Chaya. Now, suppose you ignore that and then you go for another heavy breakfast and then probably indulge something in similar, substance and sleep over it during the day as well, then it causes indigestion. And indigestion can lead to maybe diarrhea or any of these kind of, episode. So that is the whole process of that episode. Whereas you saw the first feature of it at the when you had this heavy meal itself, that there is a slight heaviness. That is the stage of Chaya. And at that time, you just have the simple solution for that is don't indulge in a similar activity. That is a very simple rule to follow. So suppose we all follow this simple rule, that we eat only as much as we can digest and not indulge more in substances which can gravitate us or pull us more into a similar circumstance of imbalance, then that is one of the best things to do. And this specifically in terms of food and also activity. Next level is Prakopa. Prakopa, now continuing the same example of having the heavy meal. Prakopa, a stage of Prakopa would be where there would be probably some bloating or pain in the abdomen because you've eaten too much and it is physically causing some kind of discomfort. Physical discomfort like maybe bloating or distension or even not feeling hungry or feeling too full even after 4 or 5 hours. That is the stage of Prakopa. And again, it can be easily prevented if you take something which can reverse the situation. Say, for example, in this example, you could have something which will help the digestion. Maybe have a cup of warm tea, like a green tea or any of the herbal teas that will improve the digestion and move the contents of the intestine and reduce the bloating, ease the bloating. These are the things that could be done at the stage of Prakopa. Now, it sounds so simple, both at the level of Chaya and Prakopa, but it requires you to understand your body very well and to respond it in time and not to overlook it. Most of the times, we all would have identified these situations. When you exercise, there will be a point where it feels like, no, I have to stop now. But then because of the external influence, or because you see you have set to yourself a time, like I have to do it for 1 hour or 45 minutes, you extend or you push yourself to do it. Or there will be a point, even while eating, that you think that it is enough. Or you look at a substance and you feel the initial gut instinct says that this is not for me. But either because of the social pressure or because of any other factor, just out of temptation, or maybe something like a guilty pleasure or whatever, we indulge in. And that is where we consciously cross the line and push ourselves into downward lane, make it difficult for our body to manage. So being mindful of our situation and constantly trying to reverse the imbalance is what is necessary, and that is the one which can keep us healthy on a long run. And the next stage is prasara. Now this, in the given example, in the context of GI, it would be something like that there was a stage where it was bloated and it was heavy. and now it is probably giving you heartburn, the reflux, or it is the whole of the body feels a little dull and stiff, or there is aches and pains here and there. If there is a previous ache, then it flares up. That is the stage where doshas have moved out of the place of its initial vitiation, and it is now moving all over the body and then lodging into different places. At this time, you need to treat or you need to stop yourself from indulging again in the same activity, which can cause the vitiation, and also treat the dosha. It is necessary to bring a treatment here. So, have some of the herbs or do some kind of activity which can bring it back, but treatment intervention is necessary here. Whereas in Chaya and Prakopa, in Chaya there is nothing to do. You just don't do it again, the same activity. Don't indulge in the same activity once more. In the stage of Prakopa, you just help the body, like do the improve Agni or just manage the dosha only. Whereas in Prasara, the third stage, you need to treat the cause as well as the dosha. So, see, gradually the intervention, the amount of intervention goes on increasing, and from the stage of next stage onwards, it is a proper disorder. And it goes on becoming more and more difficult to intervene, more and more complicated or complex to intervene. All of the lifestyle disorders, irrespective of what system it involves or where the presentation is and how chronic or how instantaneous it was, without an exception, all of the lifestyle disorders go through this process of Chaya, Prakopa, and Prasara. And that is why it is so important to identify and reverse, because that is the only way you can prevent. And this is a general line of treatment for prevention and as well as for management of mastopathy. The first and the foremost that could be thought of is Panchakarma Shodhana. So proper Snehana and proper Shodhana is very, very helpful. And it could be some of the external applications as well. The details of all of these, what herbs can be used and what specific can be done, are all discussed in the Women's Health course. I'm just giving the outline of it. And depending upon the specific presentation, if it has got proper cyst, then treat it like the cyst, or if it is fibroadenoma, we have to treat it like a fibroadenoma swelling. And so depending upon the specific presentation, there are many options for treatment, and we can go for any of these options. It could be Raktamokshana or surgery or chemical cautery or even cautery, or sometimes even Krimi Chikitsa or the therapy for the Krimi, parasite therapy is also very useful. So this is the general line of treatment, which has to be specifically applied depending upon the case presentation. So instead of going into the details of every step here, I think we can go to answering a few of the questions in keeping time in mind. So the first question, Vasant Lal recommends gentian for treatment and dandelion as well. It has the same effect. What other herbs would you recommend? Now, specifically in case of mastopathy, if that is the case, then anything that will improve the Agni and help in draining would be useful. That is in general. Now, if it has got a growth, or if it does not have a growth, and what is the pattern of the growth should also be taken care of. In general, I would say that focus on the menstrual system, treatment or the whole of the focus should be on menstrual system and not focus on the breast, because the causative factor is not in the breast, it is rather in the menstrual system. How to maintain Agni? Now this question has been repeated in many occasions here, so I'll just focus on that. Now Agni, in the context of gallbladder, with or without gallbladder, to maintain Agni, there are three things that you can do. One is to have a proper time for the meal. Second, be mindful of the quantity and quality of the meal. So eat as much as only as much as the 1/3 or maybe half of your capacity. Don't eat more than that, and especially so if there is a gallbladder, there is no gallbladder. And depending upon the quantity or sorry, the quality of the food, the quantity should vary. If it is easily digestible liquid type of food, then you can indulge in a little more. If it is hard to digest solid type of food, then reduce the quantity furthermore. So first one is time, second one is the quantity and quality, and third, specifically for in the case where there is no gallbladder, use kitchen spices. Regular use of your normal kitchen spices. It could be black pepper or cumin or even rosemary, lavender, and rocket, or any of these herbs, which can be considered into spices, which cross over to becoming medicines. So regular use of these will help in keeping the Agni.
I don't know, the question does not specify that. Maybe in case of mastopathy.
Well, otherwise one can use castor oil for a local application. It is fine, but if there is mastopathy, if there is inflammation or glandular swelling, then it is always better to be a little mindful, because you don't want to increase the vascularity there without exactly knowing what it is or what type of lesion it is. So it is always better to get that lesion tested, and unless it is, if it is fibrocystic, then definitely yes, applying castor oil would help. If it is inflammatory, no, castor oil is not to be used. So make this differentiation, and then one can go for it. So there's a specific request to name the herbs or drugs that will increase Agni in the absence of a gallbladder. So what I'm specifically mentioning here are the Agni Deepana type of herbs, Agni Deepana and Patana type. So it could be black pepper, ginger, and piper longum, that is pippali, and there is cumin, cinnamon. Cumins also come in different varieties, so all of those can be considered. Garlic is also very important, and clove, and you can also add rosemary into the same, and yeah, sage is good. Celery seeds are good. Caraway is good. Dill is also very good. So I think, yeah, keep these in the kitchen, use them more often. All right then. So see, what we have done today is very like on the top, on the surface, because these topics have much more deeper connection. Anything that goes on in the breast will have to be looked at from the context of Artha system. That is the whole of the reproductive system of the woman, and that needs a better understanding. And we have discussed or put all of this in a proper manner in the women's health disorders, so on the course of women's health. And I hope that you will have a better perspective of it, and also enjoy going through the course. So with that, I welcome you all to the course of women's health, and we will have more sessions to discuss the specific points that might come after that. So the details of the herbs are also mentioned very thoroughly in that course. So I think whatever I've not answered here today, it will all be there in the course. Thank you. Thank you all for patient listening and also bringing up the questions. And see you all again. Namaste.